Hello everyone, I am Vineet Sharma. I am the Regional Technical Advisor for Family Planning and Reproductive Health at the UNFPA Regional Office for Asia and Pacific based in Bangkok. We welcome you to this presentation where we will be presenting on how to write program abstracts for submission to the International Conference on Family Planning. This content was developed by the scientific and program subcommittees of the conference. Today, I will share with you the key elements and important considerations that will help you to prepare your abstract for the conference and increase your chances of being accepted for the presentation. You may also find tips shared in this presentation useful for other scientific writing and publications. In this presentation, we will go through 1. Why you should present at Icfp. The main sections of the program abstracts for Icfp, namely the title, program intervention or activity tested, methodology, results or key findings, program implications or lessons. First, why present your research at the International Conference for Family Planning? There are many reasons to present at the International Conference for Family Planning. Most importantly, you are contributing to the field of family planning with new knowledge. It is also an opportunity for you to learn from other presentations or abstracts addressing related issues. Icfp provides an opportunity to develop new skills and practices through interactions with researchers, advocates, service providers, program implementers, and policymakers. And finally, your presentation at Icfp contributes to your own professional development. What is the purpose of a program abstract? The purpose of a program abstract is to demonstrate to reviewers the relevance of your program and findings. A program abstract accurately summarizes the intervention, the methodology, key findings, the impact, outcomes attained, and lessons learned. The abstract should clearly communicate the preliminary or final findings in a succinct manner. Let us take a few minutes and go through each section of the program abstract. First, the title. Why is a title important? The title is the first thing that people will see. If the title of your abstract is not relevant or interesting, people just won't read it. So, it makes sense to spend some time on the title. Avoid long titles. Limit to 10 to 12 words for a title. Whenever possible, use descriptive terms and phrases that accurately capture the content in particular and the type of study. There are 4 important aspects for a good title. First, it uses few words to condense the content of the abstract. Don't try to summarize the whole abstract into your title. It includes the type of study, example, a program implementation or evaluation. It captures the attention of the reader, and most importantly, it helps to differentiate your abstract from other articles on the same subject. What is it about your research that is new or different from other studies? Here are some examples of abstract titles. The titles here provide key information about what health or medical challenges the given program targeted, the target population for the program, and or where the program took place. The title tells us about the program in a clear and concise manner. Now, let us discuss what should be in the significance or background section. Remember to stick to the word limit in each section. In this case, that is no more than 200 words. In this section of the abstract, you should ensure you clearly describe why your program or evaluation was necessary. What is known about the research, but equally importantly, what gaps remain in our knowledge? What are the limitations of previous research that are so important that more research was necessary? How does your study fill those gaps? It is a fine line to balance, but you want to describe why your question is important by summarizing previous research that highlights its importance. but also try to explain why that previous research is not sufficient. For program implementation abstracts, without an evaluation, make sure to provide evidence on why the program was necessary. For abstracts with evaluation results, describe the purpose of the evaluation, who should be using the results, context of the evaluation, and the evaluation timeline. This is a chance to iterate the importance of your study to the field of family planning. Some do's and don'ts. Please identify why your program is important and provide relevant and specific context. To the extent possible, try to identify research that has been done in the same setting or at least in a similar setting. For example, if you are doing research on adolescent family planning in Uganda, it is generally not helpful to cite findings from the US. The contexts are just too different. Use research from other similar settings. The only time that you may want to cite research from very different contexts is if you are demonstrating that your question has not been adequately studied in your given context. For example, research from high-income settings show that there is high demand for IVF, but this has not been adequately studied in low-income settings. In such a situation, you can cite examples from other contexts. Do not make the common mistake of summarizing what is known about the issue without identifying what is not known, or waste precious space or generic background information. You do not need to summarize the study settings in the abstract. This is important to remember. Finally, always be specific to the context and research question. For example, if your question is about adolescents, don't waste space talking about adults. Here is an example from the 2018 Icfp. I will pause for a moment so that you can quickly review, and then we will discuss some key components. Now, let us discuss how this section fulfills the criteria that were described in previous slides. In the first three sentences in blue, the author describes why is this question important. In the highlighted sentence, the author provides relevant health program within Nigeria that will be assessed in this research. This is contextual information. Here, in the next slide, the highlighted purple sentence shows findings from the scale-up effort and revisits what is not known about the research question. On the left-hand side of the slide is information for programs. If you have implemented a program which has not been evaluated comprehensively, you will follow these guidelines. On the right is information for programs which have been evaluated. When presenting programs, you want to discuss in a succinct manner the goals and objectives of the program and the theory of change model, if a theory of change model was used at all. Describe what specific activities were conducted, who received these activities, how many activities were facilitated, and how many people received the program activities, program delivery and receipt. For program evaluations, describe the key evaluation questions that were used to guide the evaluation activities. Clarify the type of evaluation. Was this an independent evaluation, a participatory or collaborative evaluation, or an empowerment evaluation? Lastly, you will want to describe the scope or aim of the evaluation program. What was the ultimate goal? Here are the different types of program interventions, implementation projects, and evaluations which can be submitted as abstracts to Icfp. On this slide, you can see the difference between the project objective and the project activities. The project objective clearly explains why the program was implemented. To assess the delivery and receptivity of DMPA subcutaneous. The green text outlines activities which took place during the program in order to meet that objective. Next, we will discuss the methodology, which is perhaps one of the most critical aspects of a valid and reliable program evaluation or implementation activity. The methodology section focuses on tools and techniques used for the research. It should cover, number one, the location. Where was this study conducted? Note the geographical location and anything that may be relevant to the research question. But do not spend too many words on describing the study settings. For example, you do not need to describe the overall population of the country, the age distribution, the trends in TFR, etc. Always keep in mind what do reviewers need to know versus what is nice to know. Focus on what they need to know. Secondly, data sources. What were the collection procedures, primary or secondary? The time frame. When was the study carried out? What was the duration of the study? The sample size. How many people were in the study? How were they identified or selected, included or excluded in the study? Analytical approaches. How did you define your outcome and what were the analytical procedures used? For qualitative research, what theories did you apply and coding practices used? For quantitative, what statistical models did you use? Remember, the scope of the evaluation will dictate the design, and the robustness of the design is the only way to establish causal relationships. Authors should clarify if their designs were experimental, non-experimental, or quasi-experimental. I will now give you a few seconds to read through this example. The highlighted sentences illustrate how the author described the setting and design, data sources, and analytical approach. Now, let us look at the results or key findings section. This section should be no longer than 250 words. The findings you present will vary by the type of evaluation or the type of program. For example, formative research or evaluation focuses on whether the project was implemented according to the plan, how well was it done, what was the access and coverage. Outcome evaluation looks at the change in observed characteristics of the targeted population and not the state of the program. Impact evaluation focuses on the change in the observed characteristics of the target population that can be attributed to the program. Remember, an impact evaluation requires rigorous design and analysis to establish the causal link. Think about the net effect of the program. The main quantitative findings presented will vary by the type of program. Here are some examples of key statistical results or outcomes that can be included by program or analysis type. For example, cost minimization analysis that focuses on the least costly alternative intervention among those assumed to produce same health outcomes. Cost effectiveness analysis that is developed around an incremental cost effectiveness ratio, comparing the economic value of an intervention compared with an alternative. Cost utility analysis summarizes measures comparing costs of interventions in monetary units with health outcomes regarding the utility and mortality using utility measures such as QALYs and DALYs, etc. Cost benefit analysis that compares costs of different interventions and health benefits and risks. Implementation research summarizes key findings depending on the focus of the implementation. These abstracts respond to the question, what findings from your research can improve the implementation of health policies, programs, and practices? And to answer this question, they should consider the following aspects: sustainability, scale up, fidelity, replication, feasibility, equitability, and unintended consequences, etc. Icfp accepts abstracts with preliminary or final results. We will talk a little more about that difference soon. But in either case, you should make sure that you answer the main research question or questions in this section. Describe the relevant results from the data analysis while making sure that each of your research questions or hypotheses are addressed adequately. If you don't describe the results of one of your hypotheses, reviewers will wonder why. Also remember the audience that this abstract will be presented to. Experts in family planning research are reviewing your abstract. So make sure you are emphasizing what is important from your research. Be specific and as clear as possible. Report both positive and negative findings when relevant. Don't be afraid to present null findings. This is important. Start the results section with a brief and important descriptive result before analytical results. Consider reporting your results in parallel with your methodology. That is, if you conducted analysis in multiple steps, for example, descriptive analysis, then bivariate regression, then multivariate regression analysis, present your results in that order. For quantitative research abstracts, report associations with confidence intervals or p-values. Confidence intervals are generally preferred but can take up more space. For qualitative research abstract, make sure the results are rich with depth, details, and nuance, and clearly tied to the methodology used to reach them. You may highlight the summary and main themes here. For both kinds of research, make sure you are addressing the research questions or hypotheses adequately. As mentioned earlier, your results do not have to be final to be submitted. However, they should cover key results related to your research questions. Descriptive statistics and any exploratory analysis that give reviewers a sense of what your findings may be are always helpful to include. Abstracts without any unique findings can be submitted, but most of them will be less competitive, of course. You should also be comfortable presenting results even if they are not what you expected. This includes results where there were no statistically significant relationships if this is of central interest to the research question. Do not hide results if they are central to the research question. Furthermore, don't present descriptive statistics for the sake of presenting quantitative statistics. This will not boost the chances of the abstract being accepted. Please take some time to read through this example of a results section from an abstract from the 2018 Icfp. I have colored the paragraphs in 3 different colors for easier readability. As you can see, the authors organized this section starting from the descriptive findings and reported results in parallel with the methodology to highlight findings from different activities and unique outputs from the strategies and activities employed. Finally, let us discuss the last part of the abstract, the program implementation or lessons section. This should be no longer than 250 words. In this section, you should cover the most important key takeaways or lessons from your research in a few precisely worded sentences. These 3 essential questions should be answered. Number 1, message. How do these findings address the problem or the gap that you outlined in the background section? Number 2, the importance. What are the implications for the field? What is the implication of your key lessons, highlights or findings to the existing and future programs, policies, and services? 3, the perspective. What are the recommendations for future research and evaluations? Avoid the common mistake of making conclusions that are not supported adequately by the data. Base your conclusions on what you found and not on what you wanted to find. Allow space to mention important or unexpected findings and reiterate on the implications of your findings for future family planning research, services, policies, or programs. Remember that a wide range of people attend Icfp. Translating your research findings into policy and program recommendations is critically important. Ensure your conclusions are honest and grounded in the data. Again, I will give you a few seconds to read through this example from the 2018 Icfp and reflect on how this example covers the elements that we just discussed. I have highlighted a few sentences for easy reference. Before we end the frequently asked questions, it is important to briefly discuss the important issue of research misconduct. It may be a surprise to many of you, but we have had many incidences where applicants to Icfp were disqualified because of misconduct. Good research ethics is the core of scientific integrity. Any sign of research misconduct is taken very seriously during abstract review. Citations do not need to be included in the abstract submission. However, if language is clearly copied from other sources, it provides immediate grounds for disqualification. It is mandatory for any abstract submitter to avoid any form of application, falsification, or plagiarism. We have provided here a link to the research ethics policy for the Johns Hopkins School of Public Health. These guidelines apply to all abstracts submitted to the International Conference for Family Planning. We will end with a few frequently asked questions. Probably the most common question is, which abstracts are more likely to be accepted into the International Conference for Family Planning? This question is not as simple as it sounds. Your abstract is more likely to be accepted if it strictly follows the guidelines and word count, but ultimately, reviewers will judge the scientific integrity and contribution of your book. Abstracts that skip sections or do not provide sufficient information are much less likely to be accepted. The Abstract Selection Committee tries to prioritize abstracts presenting new knowledge or evidence. Findings should be supported by the data as well as a clear analysis and sound methodology, irrespective of the language in which the abstract is written. Abstracts in English or French language are all treated equally. Please ensure clarity of the language used in the abstract and review your abstracts to make sure there are no typos or grammatical errors. Another very common question we receive is, why does Icfp have 1,000 words limit for abstracts, while other conferences often have abstracts that are around 300 words only? The International Conference for Family Planning is unique in this way. Our main goal is to allow people to share new knowledge to inform practice. Icfp allows up to 1,000 words for individual abstracts and 400 words for abstracts submitted as part of a pre-formed panel to provide sufficient details that allow the scientific committee to appropriately review the abstract and make a fair decision. There are many do's and don'ts to have a successful abstract. In the US, we often say, don't play baseball in a football game. For other settings, maybe we could say, don't play cricket in a football game. In either case, this is a conference on family planning. If your topic is not really related to family planning, it just won't be accepted. Keep in mind the rule of three: simple, clear, and comprehensible. Avoid very long sentences and dense paragraphs. Do not use unusual terms and acronyms without defining them properly. Consider having your abstract reviewed by a native speaker of the language of your abstract before submission. Finally, for quantitative abstracts, be consistent when you include confidence intervals or p-values, and always use the same number of decimals. Also, although it is common, please avoid passive voice. Consider using the present tense to describe the problem addressed by your abstract and implications of your research findings. You should use past tense when describing methods used, results found, and study limitations and strengths. Please never start a sentence with a number. These are all small tips that can help your abstract stand out. Remember, the abstract is about what you did, how you did it, what you found, what you learned, and why should anyone care about it. Please don't try to summarize all content of the paper in your abstract. Just include what is necessary. I am sure you already know of many resources about writing an abstract. Here are a few that you may find useful to learn more on what we discussed today. Thank you for your time. If you have any questions about abstract submissions, please do not hesitate to reach out to our colleagues Jean-Christophe Busatira at abstracts@icfp2021.org. Thank you very much, and we hope to welcome you to the International Conference of Family Planning. See you there. Bye-bye.